Welcome back, everyone. I'm joined now by Dr. Heather Gregory-Martin from Northern Light Hospice. Thanks so much for being here today.
Thank you for having me.
And so we're talking about starting a conversation that can be a little difficult, a little daunting for many people. My first question, is it ever too early, though, to start the conversation around hospice care?
Well, I would say it's never too early. The earlier, the better. We can always come and have a conversation about what hospice would mean for you or your family. And sometimes it's better to bring it up when things are actually going okay, but you have a diagnosis. For example, mom or dad or Uncle Joe, I know you have this illness and I know you like to handle things, but if there were ever a time where you needed help, we want to know how to do what you want. So if you were really sick or you couldn't answer questions, what would you want, and how can we make sure that we're following your wishes?
And you want to know those things before it gets too late, and you can't have those conversations. And
right.
You also mentioned, what hospice care might look like for you, because it's going to be different depending on the person, correct?
Correct, yeah. Lots of times hospice is brought in when patients are not wanting to go back to the hospital, or they're doing treatments that aren't making them really feel better anymore. But a lot of times we're a huge help for the family and the caregivers. We bring in support such as social workers and aides and nurses and volunteers, chaplain, all those things that can help the whole unit, really help with gain back precious time maybe.
Yeah, and obviously you've worked in this field, so you know what it's like. Maybe what are some of the misconceptions, is it coming from an expert about hospice care, that you'd like to let people know about?
So I first started in emergency medicine, so some people may know me or recognize me from working at Eastern Maine, but I've been doing hospice for the last 3 years, and after doing a fellowship. And it's not just for the last days of life. I think that's the most important thing that we can say. Really, it's a joy when, not every patient, but sometimes we do things to maximize their medications or really focus on their symptoms, and we give them a boost, and they can do things on their bucket list. I mean, we've had patients take trips and really do things. Our foundation can help with things like that as well, and that gives the team, a boost. But that's not, that's really why we're here. We want to talk to you early so we can make the best out of your time. And
I've heard of certain situations where hospice care has actually helped to extend people's lives as well.
It has. People may know that hospice is a Medicare benefit, so anyone over the age of 65 really does have the benefit, and it's meant for the last months of life, but we have people who are on for years at a time. As long as they're benefiting from what we're doing and they have a diagnosis. I want to mention that CHF, COPD, liver failure, neurologic conditions, strokes, not just cancers, are for hospice.
Wonderful, thank you. And if people want to learn more, want to get in touch, how can they do so?
So your PCP or any doctor can refer you, but you or your family members can call us directly. I work for Northern Light Hospice. We're a community nonprofit hospice. I can answer questions, but we have a triage system. I'll tell you a number. It's a 1-800 number, 757-3326.
All right, and we'll have that number on our website as well. When we post this interview, you can look for it there.
Thanks.
All right,
Thanks for having me.
Thank you so much for coming, Dr. Gregory-Martin. We appreciate it.
Pleasure.
And your full extended forecast is coming right up. Stay with us.